MP Lloyd for 5 minutes, please.
Thank you, Mr. Chair, and thank you, Minister, for being here today. I appreciate your comments in the House that when you said you would do anything for veterans and veterans' families. Regarding mental health services for families, I have been informed that families are afraid to come forward, fearing retribution from your department. I just want to put it on the record today. Can you unequivocally assure these families that they will not face repercussions for coming forward with their challenges with your department?
First of all, thank you so much for stating such an issue, if it does exist. I am not aware, but if it is, I can assure you I will have their back. That is what we're there for.
Thank you, Mr. Minister. At a previous meeting, department officials claimed that no one has been cut off. However, we know the case of Shane and Veronica Jones, who have been paying $600 each month out of their own pocket to pay for their daughter, Ruth Jones, who's 14 years old, who is suffering from a number of challenges that doctors have said is related to their father's traumatic brain injury, which is related to his service. Mr. Speaker, why has this family been cut off?
Thank you very much. And again, I appreciate your question. As you know, I've indicated and stated a number of times, this program is to remain as it was and to be, if anything, more flexible. And you're also aware that I could not discuss a specific case. I would not.
Thank you, Mr. Minister.
Anything that can be done, and if anything you have that relates to a personal issue, you can bring it to me. I'll do my best to help in any way possible. But if it's a direct effect of the veteran itself or affects the veteran, I would be very surprised if they cannot qualify. But
thank you, Minister. I appreciate that. You said earlier, you made a comment earlier in response to one of my colleagues' question, that support was linked to cases where a family member is affected by the veteran's challenges. And I think we could all appreciate around this table that that would be a good criteria. However, in the previous committee meeting, your departmental staff said that funding must be linked to cases where it is a veteran's caregiver and it must be short-term. So there's a discrepancy here where the department is saying that it must be related to veterans' caregivers and it must be short-term. But you just said earlier this meeting that it could be connected if the family member is affected by the veteran's challenges. So which is it with your department, Minister? Which case is it?
a family member can receive benefit if it affects the veteran. If I misspoke, I apologize.
So if a family member is affected by the veteran's challenges, so in the case of Ruth Jones, she is suffering from mental health challenges that doctors have said is related to her father's PTSD, she has been cut off. So it's the policy of the government to cut off family members who are suffering because of their veterans' family members suffering.
Well, the policy has not changed, and if it affects the veteran, then the family does qualify. But I would let my deputy, if there's anything that's...
Yeah, thanks very much for the question. I just want to be absolutely clear here that we work closely with the mental health provider, that the mental health provider who is focused on the well-being of the veteran, because that's where our jurisdiction is, the mental health provider will tell our staff that the veteran's well-being would improve if a family member is also treated.
Now, Deputy Minister, is this, to clarify, is this the Veterans Affairs mental health officials, or are these the doctors of the families?
Again, the mental health provider, because Veterans Affairs does not provide health care. We partner with all the provinces. Okay. And so all of the additional support either comes through any one of the 11 operational stress injury clinics or our accredited 4,000 mental health providers coast to coast to coast. So the mental health provider will come to us and say, in treating this veteran, we know that the veteran's well-being will improve, their situation, he or she's situation will improve if we are also able to treat the family.
Thank you, Deputy Minister.
Can I just add?
Well, I only have about 45 seconds left, but I appreciate that. Deputy Minister, if a family member is being traumatically affected, you can agree, I'm sure, that the veteran will be affected. But I just want to clarify that we have documents from your department that admit that provincial plans are disjointed and irregular. I quote, disjointed and irregular. Why is your department passing off veterans' families onto provincial plans that your own department recognizes are disjointed and irregular?
Brief answer, please.
Again, in our context, we partner with every one of the provinces across the country. Again, we were able to provide this additional support through the operational stress injury clinics and leveraging the mental health providers across the country for veterans and for families as it affects the veteran's situation. But in each province, the department does not have jurisdiction to support to provide support to those family members. So we work with all of the caregivers in the area to establish the links, and in addition to that, folks can have access to our 24/7 additional support and have 20 counseling sessions per issue that they may have in order to, I would say, balance the support across the country.
Thank you. MP Sam, thank you very much. MP Lloyd for 5 minutes, please.
Thank you, Mr. Chair. Sorry. It's not my job to cheerlead the government or the department. There's 5 people across the table who are doing an excellent job of that. It's my job to hold the department accountable for our veterans, and then overall I think we will get to the best outcome for people. And when I hear the minister and yourself say compassion, flexibility, and we'll be there when and where veterans and their families need them, the rhetoric is not matching the reality of the situation that we're hearing on the ground. At least 133 families have been told that they may be cut off from mental health services. 20 sessions on a 1-800 number is not the same as in-person counseling. It's a great program that we have, but when we're cutting off counseling, in-person counseling, these are important programs for families of veterans. So will the department commit going forward to close the gap that we've seen increasing with families of veterans who are not getting the mental health services that they deeply need and deeply deserve to have?
Well, thanks very much for the question. And I know that this is a really troubling issue. And again, the challenge is one of a federal institution providing mental health support to non-veterans, which generally in our construct is a provincial jurisdiction. And therefore, the authority that the department has is focused on the well-being of each and every veteran. It is difficult drilling down to each one of those families that are struggling with their current circumstance and recognizing that mental health illness, mental health injury is a nationwide problem. And having had a member of one's family who has made sacrifices and served impacts the family. But again, it is the department working with each and every one of the mental health practitioners to provide the best support we can, either through face-to-face counseling or using the again assistance capability, which is 20 sessions per issue that family might be suffering through.
Minister, or Deputy Minister, we know that this gap, it's troubling. And we know these families are suffering. And your department has been providing short-term care for these families. You've been telling us that it's short-term related to a veteran, but now you're saying that it's a provincial responsibility. So how can your department say that it can provide short-term care but cannot provide long-term care because it's a provincial responsibility? Why can't you extend the program to ensure that families, so that the outcomes can be achieved? You're saying you want to achieve outcomes, but we know that there are families that are coming forward and they're saying the outcomes have not been achieved. We have been cut off. We've been paying $600 a month out of pocket for these services.
No, thanks very much for the question. And again, the department itself does not provide care. All of the caregivers are working within a provincial jurisdiction. And that the authority that the department has, again, through our government machinery, is focused on the well-being of that veteran.
Deputy Minister, though, when you're cutting off the funding coverage, you are effectively cutting off the care for the families. Wouldn't you agree?
I would also say that, as my soon-to-retire colleague Michel Doiron indicated, we don't cut people off the program, again, from a compassionate standpoint. we will allow the program to be completed so that objectives, as the mental health practitioners say, that the goals of the treatment are completed. But at the end of the day, as Rick has outlined, and the ombudsperson, not only Mr. Craig Dalton, but his predecessor, Guy Parent, have highlighted is in some ways there is an argument for treating veteran families in their own right. We don't have that authority.